Hawthorn is marketed as the heart herb, genuinely shown in real trials to help people with heart failure feel better. Here's the question actually worth asking. Does feel better mean treats the disease? A landmark 24-month trial on nearly 3,000 patients tried to answer that directly. By the end of this, you'll know what it actually found, and it's not what most marketing implies. Respect tradition. Verify with evidence. Quick note first. This is education, not medical advice. If you have heart failure or any heart condition, are on cardiac medication including digoxin, are pregnant or nursing, talk with a qualified healthcare provider before adding concentrated Hawthorn to your routine. Educational purposes only, not medical advice. Consult a qualified provider, especially if you have a heart condition, take cardiac medication, or are pregnant or nursing. So what is Hawthorn actually? Botanically, it's a genus called crataegus, and here's the first thing worth knowing. Hawthorn isn't one single thing. The species behind almost all the heart research is European. Crataegus monogena and Crataegus levigatu. A completely different species grown and used in Chinese medicine gets used for something else entirely. Traditionally for digestion, not the heart. Same genus, two different traditions. Here's a second, more practical distinction. Almost every clinical trial behind the findings we're about to cover used a standardized extract made from the leaf and flower, not the berry, but a lot of what's sold to consumers, and most of the historical folk tradition, uses the berry, dried, tinctured, or as tea. Keep that in mind. What's on the shelf isn't always what got tested. We'll come back to this. And here's something that might surprise you. Hawthorn's reputation as the heart herb isn't actually ancient. The earliest medical writers who described it, Dioscorides in the 1st century, recorded it for digestion and pulling out splinters, not the heart. The heart connection is much newer. The story goes that a physician in Ireland built a quiet reputation in the late 1800s treating heart disease with a secret family remedy, only revealed after his death to be a tincture of ripe hawthorn berries. Within a few years, doctors in the United States were publishing on it too. So the ancient heart tonic framing you'll often hear is a bit of a stretch. It's closer to 130 years old than 1,000. Before the evidence, a genuinely strange one. Hawthorn is Britain's only common plant named for the month it blooms in. It's literally called the May tree. And yet, for centuries, bringing its blossom indoors was considered deeply unlucky. Here's why that folklore might be more than superstition. Hawthorn blossom actually contains trimethylamine, the same compound produced early in tissue decomposition. The flower genuinely smells a little like death. That's real chemistry behind old folklore, not marketing. Every claim today gets rated on our confidence scale, 1 to 5 stars, based on how strong the actual human evidence is. Let's start with the claim Hawthorn is actually famous for. Multiple clinical trials, pooled together in a Cochrane systematic review, agree. Added on top of standard treatment, Hawthorn extract measurably improves exercise capacity and reduces symptoms like breathlessness and fatigue in people with mild to moderate heart failure. People could do more work on a stationary bike, and their hearts didn't have to work as hard to do it. 3 stars. This is genuinely emerging evidence, not a fluke. Put a number on it. Across the pooled trials, people on Hawthorn managed about 5 more watts of maximum workload than people on placebo. Genuinely modest, but a real, measurable, statistically significant improvement, not a rounding error. Here's the honest limit though. Every trial in that pooled analysis ran 3 to 16 weeks. None of them tracked whether patients actually lived longer or stayed out of the hospital. They measured feeling better, not the disease itself, which raises the obvious next question. So a much bigger question needed a much bigger trial. It got one, nearly 2,700 patients, every one of them already on modern standard heart failure therapy, followed for 2 full years. the largest, longest Hawthorn trial ever run. The question, does adding Hawthorn actually reduce death, heart attacks, or hospital stays? The result, no. 28% of the Hawthorn group had one of those events, versus 29% on placebo. A difference so small it wasn't statistically meaningful at all. The single largest, most rigorous test of Hawthorn's flagship claim found it does nothing to change the actual course of the disease. One honest, smaller footnote worth naming. A separate, much smaller American trial found no symptom benefit either. And in a secondary look at that same small group, researchers noticed people on Hawthorn seemed to get worse, faster in the first several months. That signal didn't hold up over the full study, and the researchers themselves said it was probably just chance in a small sample. And importantly, the much larger 2-year trial found no sign of it at all. Worth knowing, not worth panicking over. What this means: Hawthorn has real repeated evidence for helping people with milder heart failure feel measurably better in the short term. What it doesn't mean, that it changes whether someone with heart failure lives longer or stays out of the hospital. The best, largest evidence says it doesn't. Practical takeaway: this is a genuine case where helps you feel better and treats the disease are two different claims, and only one of them has real evidence behind it. Hawthorn also gets marketed for blood pressure. The evidence here is a real mixed bag. One pooled analysis of several small trials found a meaningful drop in the top blood pressure number, but not the bottom one. Other individual trials found nothing at all. And one recent trial actually found blood pressure moved in the wrong direction, though that trial used a sweetened Hawthorn drink, which muddies the result. 2 stars, a real signal, but genuinely inconsistent. One trial specifically in people with type 2 diabetes, most already on their own blood pressure medication, found a small but statistically real drop in the bottom number, but no meaningful change in the top number at all. That kind of split result, real on one measure, absent on the other, is exactly why this claim lands at 2 stars instead of 3. There's something there, but it's not consistent enough yet to call it settled. Hawthorn also gets claim for angina, cholesterol, and anxiety. Quickly, honestly, angina has essentially no modern clinical trial evidence behind it. The trials that exist are decades old, small, and from long before today's research standards. Cholesterol trials in humans have mostly come back null or even moved the wrong way. One recent trial actually found the good cholesterol went down, not up, on Hawthorn. And the one real positive anxiety trial didn't test Hawthorn alone. It tested Hawthorn combined with 2 other ingredients, California poppy and magnesium, so it genuinely can't tell us what Hawthorn by itself does for anxiety. All 3, 1 star each, traditional use, not modern tested. So practically, the trials behind everything we just covered used a standardized extract of the leaf and flower, not the berry, typically around 900 milligrams a day, for weeks to months. Remember Act 1. If what's on your shelf is dried berries, or a berry tea, that's a different product from what actually got tested, which brings us to safety. And here, Hawthorn has a genuinely interesting story, because one of its most repeated warnings turns out to be mostly theoretical. You'll often see Hawthorn paired with a scary warning about digoxin, a common heart medication. Here's what actually happened when researchers tested it directly. A controlled study giving people both Hawthorn and digoxin together found no meaningful change in digoxin levels in the body at all. The case report that circulates online as proof of a dangerous interaction wasn't even about someone taking digoxin. It involved a different, unrelated product entirely, which we'll get to in a moment. The largest Hawthorn safety trial ever run, the same one from Act 2, with over half its patients already on digoxin, found no interaction at all. Cardiac medications, theoretical caution. Hawthorn may theoretically add to the effect of other heart medications, beta blockers, blood pressure drugs. but a review of over 5,000 trial patients found no documented interaction cases. Still worth a conversation with your provider if you're on cardiac medication, since theoretical isn't the same as impossible. Pregnancy. No reliable human safety data exist either way. Regulators recommend avoiding it in pregnancy simply because it hasn't been studied. An absence of evidence, not evidence of harm, but still a reasonable default toward caution. And genuinely reassuring, Hawthorn's overall safety record across the largest trials is essentially identical to placebo. In the same 2-year, 2,700 patient trial from earlier, 67% of the Hawthorn group reported any side effect at all, compared with 68% on placebo. That's about as clean a safety comparison as this show has seen. Its liver safety rating is about as clean as it gets, too. Now, the real safety story. And it's not about Hawthorn itself. In 2024, regulators found that some weight loss products sold under a Hawthorn-adjacent name had been adulterated with, or entirely replaced by, a completely different and genuinely dangerous plant, yellow oleander, which is severely toxic to the heart. That's the product behind the digoxin case report from earlier in this section. Not real Hawthorn at all. This is a supply chain problem, not a Hawthorn problem. Know exactly what you're buying from a source that verifies it, especially with any product using an unfamiliar or regional name for a familiar plant. So here's the honest scorecard. Heart failure symptoms, 3 stars and real but short-term only. Actually changing the disease's course. The largest trial says no. Blood pressure, 2 stars, genuinely inconsistent. Angina, cholesterol, and anxiety alone, 1 star each, traditional use not modern tested. And the digoxin warning everyone repeats, mostly theoretical, not documented. Which leaves us with this. Hawthorn can genuinely help some people with heart failure feel better, and that's real, not nothing. But feels better and treats the disease are 2 different claims. And the best evidence we have only supports one of them. Knowing which one you're actually being promised is the whole difference between honest herbalism and marketing. If that's the kind of grounded, honest herbalism you've been looking for, subscribe and grow with us. And next time, echinacea, one of the most reached for cold remedies there is. Does the immune evidence actually hold up? Respect tradition. Verify with evidence. See you next time.